Nasal Myiasis. Imagine a patient coming to the ENT OPD with foul-smelling nasal discharge, occasional bleeding from the nose, swelling around the eyes, and a sensation of something moving inside the nose. A few days later, tiny worms start crawling out of the nostrils. This condition is called nasal myiasis. In simple words, nasal myiasis is maggots in nose. Maggots are the larval form of flies. The word myiasis comes from the Greek word maya, which means fly. They infest the nose, nasopharynx, and paranasal sinuses, causing destruction. Several species of flies can cause nasal myiasis, particularly the flies belonging to the genus Chrysomya. These flies are attracted to the foul-smelling discharge seen in conditions like atrophic rhinitis, syphilis, leprosy, infected wounds, ulcerative lesions, etc. The female fly lays approximately 200 eggs at a time. Within 24 hours, these eggs hatch into larvae. The larvae then begin feeding on surrounding tissues. Proteolytic enzymes released by the larvae causes tissue destruction. So it can lead to extensive destruction of nasal mucosa, turbinates, nasal septum, paranasal sinuses, soft tissues of face, palate, and orbit. Moving to the clinical features, for the first 3 to 4 days, patients may experience intense irritation, sneezing, lacrimation, and headache. The eyelids and lips become swollen. As the larva grows, nasal obstruction increases. Epistaxis, that is bleeding from the nose, can occur and foul smell develops. Patients may not be aware of the larval infestation until the 3rd or 4th day when maggots start emerging from the nostril. It causes extensive tissue loss. It can lead to chronic infection, perforation of the palate, eye complications, or rarely meningitis. Death may occur due to meningitis. To diagnose this case, one must look for history of foul-smelling discharge, chronic nasal disease, poor hygiene, or maggots emerging from nostrils. Anterior rhinoscopy or nasal endoscopy reveals larvae. Moving to the treatment, all the visible maggots should be picked up using forceps. However, many larvae try to hide deep inside dark cavities when exposed to light during nasal examination. Application of chloroform water and oil-based preparations help kill or immobilize the larvae. Rinsing with warm saline removes dead maggots and necrotic debris from the nasal cavity. Apart from this, patients should maintain nasal hygiene, avoid fly exposure, use mosquito nets if necessary, and should keep the surroundings clean. And that wraps up a high-yield overview of nasal myiasis.